Welcome back. Now we're moving on to rules number 3 and 4. So here's rule number 3. If you want physician engagement, then start with what they're already engaged in doing. And we discovered this one, I discovered this one, or at least personally, looking at a robotics program. I subsequently wrote a book on it called the Robotics Program. We also do another course on this as well. So if you're interested, please feel free to peruse those. But what happened was we wanted to get together a group of physicians, and we were getting some names and recommendations, and it just didn't seem like it was very representative of the organization. And so I ran a usage list, learning a lesson from value analysis, and looked at the surgeons who were the busiest surgeons on the robot. Not only that, but we were able to get outcome data, and we were able to see who had the best outcomes in terms of the lowest complications, lowest costs, and lowest length of stay, all of that stuff, and identified a group of surgeons that were the busiest surgeons who had the best outcomes in the system. And guess what? We sent them out an email and said, hey, we're trying to put together a robotics oversight committee. We'd like you to be a member of it. Would you be willing to provide, become a member and provide time with that, with our organization or with our committee? And we're looking to improve the overall outcomes and utilization and costs of robotic-assisted surgery. And guess what? This group all signed up. Why? Because that's what they were already doing. They were already passionate about the technology. They already were working to improve their quality. They were working to improve their overall utilization and costs. And so this group was already engaged. I didn't have to do anything. They walked into the room engaged, and that's the best kind of physician or any group that you can have on your, or any person you can have on your committee. So that was a huge advantage for us, and it taught me an important lesson, which is go out there and find out what they're already engaged in doing. And the nice thing about hospitals is we have all kinds of data. And so you can go in and you can find exactly what physicians are doing in terms of types of cases they're doing, the types of diagnoses they're treating, the work areas that they're in the most. And you can find out who's the people who are already part of this program that are trying to help you. And you just have to engage them in what they're already engaged in doing. You can make a lot of progress with them. So always keep that in the back of your mind. That's always a nice, easy way to get engagement. Here's another one. Rule number 4. If you want physician engagement, help them solve a problem they're attempting to solve. And we were looking at our observed to expected complication ratios for bowel surgery, and we identified what we thought was an opportunity, and we wanted to move that chart from the right side, move everybody over to the left side. And originally what a lot of people said was, oh, you just have to figure out how to get rid of the guys on the right side and that'll take care of the problem. Well, not really. But it really what you have to do is you have to change clinical practice. And so we wanted to know what clinical practice was actually associated with improved outcomes. So we focused on the left side of the chart. So those who had a observed to expected ratio, this is risk adjusted and it's compared, this is using the Premier database. And we used the select category, so it was like the best of the best in Premier. And so, but we wanted to figure out who are the people who are getting the really, really good outcomes and what are they doing. And lo and behold, what we discovered is that of all the surgeons that were over there on the left-hand side, there was one that had done 2/3 of the cases. And that just, to me, that's a, wow, pay attention. This is trying to tell you something. And we looked at his practice, and what we found was that he had already had implemented a enhanced recovery program for all of his patients. And he was able to stick with it. His biggest problem, the problem he was trying to solve, was he couldn't get the surgeons around him to buy into it. In fact, actually, his own partners weren't willing to buy into it. And so he said, look, it's interesting you want to do this across the system, but I've been trying to get people to change for years, and I haven't been able to do it. And I think part of it was there was a lot of systemic obstacles in the way, preventing him and other people from doing this successfully. So we supported that. We developed an initiative around reducing complications associated with bowel surgery, and in particular by doing it with an enhanced recovery program. So we were able to help him solve a problem that he was already trying to solve. That's how you get engagement. Not only that, but as we did that, we got engagement of other physicians who were also beginning to see this and understanding how they could change their clinical practice and have that be facilitated in a way that led to real improvements in patient care. Again, getting back to that whole thing of what surgeons value, in this particular case, good patient care. And that was a big bonus for us. So we'll be moving on. And again, if you have any questions, feel free to contact me. But we're going to go on to our next section.